Hello and welcome to another episode of Finest Design. I'm Ali Ghanem, and in this episode I'm going to take you through how we can use technology and aesthetic surgical procedure to improve our body. We talked in the last 6 episodes about the face and the regenerative factors. The body is also subject to psychological and emotional well-being. As in the face, sometimes aging process or pregnancy or childbearing might have a huge impact on how our body is shaped. In the occasions when, with the best of intentions and best of effort, the body image is still a cause of concern, we have also several options that they can be also classified, like in the face, into green, amber, and red options. This device, for example, is a fascinating evolution of technology where it can deliver electromagnetic current to stimulate the entire musculature of the abdomen, leading to over 20,000 contractions in half an hour. That's almost equivalent to going to the gym for me for 6 weeks. You can see how engineering and science have helped us move forward in this. Please join me in this episode to discuss these options with 2 of the finest colleagues that I have. I'm very honored today to have 2 of my very good friends and colleagues to take us through what we can do to improve our body. Dr. Marwen Youssef, thank you so much for coming all the way from Paris, France, to join us on this episode.
Thank you, Dr. Ghanem.
So we have been exploring tools and problems in our facial appearance that may be affecting our psychological and emotional well-being. Now, does the body also undergo such changes as in the face?
Yes, of course. The body as the face is made of layers. So you have the muscle, the fat, and the skin, and with time and aging and life experience, you will have an effect on these three aspects. So you have losing skin with the age and after pregnancy, for example, and you can have excess of fat and also sometimes a loss of fat. And with the aging, also the muscle can be hypertrophic. So our work have to manage these 3 aspects of aging.
So as the body changes after aging or childbearing and birth, what are the tools available in modern medicine and surgery to combat these changes?
Fortunately, nowadays we have a lot of tools to manage this aspect, non-surgical, semi-surgical or surgical tools, and we have to use all the panel of this tool to achieve a natural result. So for example, we can use radio frequency to treat external layers like skin and neocollagenase thanks to this radio frequency. Also we can use heat or cold to treat the fat excess, and electromagnetic stimulation to enhance the muscles underneath. And we can use also semi-surgical treatment like radio frequency with devices that can stretch and tighten the fat inside. We can use it on the body, we can use it on the breast, on the arms, and this kind of procedure can avoid a large scars. Before we use it to have a large scarf on the arms or tight or tummy, little cases, but now we can use radio frequency and avoid a great surgery. And when the problem is advanced, we can consider surgery.
So now we have a lot of advances in techniques of surgical intervention for the body. Historically, liposuction started as a debulking procedure. Now we hear our colleagues talking about high definition, medium definition, laser-assisted liposuction, etc. What are these toolkits?
Yes, now the liposuction is more about sculpture, and body contouring is about sculpturing. And we have a lot of technology tools to achieve this natural result with radiofrequency, laser, and ultrasound. Another aspect of body contouring is fat transfer. It helps to make the result more natural and high definition.
We have heard a lot about changes in the way we do fat transfer in the last couple of decades based on patient safety. We have heard of some catastrophic, unfortunate cases where some patients lost their life after fat transfer. How we can work to improve the safety of this?
There is a guideline about the fat transfer. We have to do it with ultrasound assisting fat transfer. It avoids embolism and it avoids such accident. So it is safe now.
That was fascinating. Can you tell us what would you recommend to our audience to enhance their experience of aesthetic surgery of the body?
Okay, we have a holistic approach of plastic surgery in our practice. So we take care of the patient in her different aspects: emotional, mental, and physical. So we work close with the therapist that prepare the patient before the surgery, and after surgery we are using technology with therapists, including lymphatic drainage and radiofrequency also, to make the outcome the fastest and the result optimized.
Thank you so much. That was very insightful, and I thank you again for joining us on this episode.
Thank you, Dr. Ghanem.
Pregnancy and childbirth have a huge burden on our mothers, sisters, and wives. And I'm very grateful to Dr. Associate Professor and Mr. Ahmed Sayasneh to have joined us all the way from the South Bank of London to explore these changes and what we can do in order to reverse them into our finest design. Mr. Sayasneh, welcome to Finest Design.
Thank you so much for the introduction, and I would say it is a wow introduction, and wow, as we all know, stands for well-being of women. So it all starts from the principle of believing in the well-being of women. That covers all the aspects before the childbirth, during the pregnancy, and after the pregnancy. So it is a holistic approach to make sure that the women are ready for this stage and to educate them about what can happen and then to treat what can go wrong.
What are the changes that we see in the human body when undergoing this process?
So because of the effect of the baby, the heaviness, the increase in the weight, the body mass, the hormone changes, all this will have an effect on the muscle, the collagen, and on the skin. And of course on the vaginal, and particularly as a gynecologist, I'm focusing on the vaginal prolapse and the incontinence and the bladder ligaments, and all these changes which can lead in severe cases to complete incontinence or complete procedentia or complete prolapse of the womb. This is why it's very important to be ready to talk about these things and treat them very easy and straightforward in the beginning before they complicate the course of the woman afterwards.
Mr. Sayasneh, we collaborate a lot in relation of body restoration for aging or for pregnancy purposes, and I'm always relying on your experience in this field, coming from your care for patients with cancer and complex reconstruction. What tools are available for us now in order to reverse or restore and repair the female intimate organs?
Indeed. So because of the knowledge, as you said, Prof. Ghanem, in cancer, that helps me in understanding all the different material effects on the gynae cancer in particular. So I know for sure, for example, that the PRP, which is a material we use sometimes in our treatment for the vagina, completely safe and risk-free from the cancer point of view. So this knowledge over the years enabled me to try and test different materials like the PRP, like the PRF, like the laser treatment, the radiofrequency treatment. The gadgets are so many available, but you have to select the right patient to the right gadget. With all of this will come the package of having a psychosexual support, a psychology support, you as a plastic surgeon support, or my colleagues. So this is a teamwork, and in the end, each patient will get the treatment she needs.
Incredible. Now, what's new in aesthetic gynecology?
So there are so many things now we're using in terms of bioidentical hormones. So there's lots of research being developed about using the right hormone for the right lady and how to balance these hormones based on each patient. So I can tell you from my experience, there's no patient who will take the same hormone like the other. So each patient has got treatment tailored according to her. The same with the invasive and the non-invasive procedures. There are surgical and there are conservative things we can do, and the non-invasive surgical gadgets we have developed a lot from the way of what laser we use. Is it the CO2 fragmented laser to the using the radio frequency, which radio frequency we use. So the machines are developing and evolving, and we see which each machine, one patient.
And amazing. And finally, may I ask you, in relation of this journey, how the patient can be best prepared for it?
So as I said, the holistic approach. So we work as a team. We are so many people. We look after the woman. Education is part of the journey. Explanation, counseling, psychosexual counseling, seeing the partner as part of the journey is extremely important, and taking on board each woman's needs are different. In the end, we are treating satisfaction for the patient. So the satisfaction for one patient can be different from a satisfaction to another patient. So that's why we work as a team, multiple surgeons available, multiple psychologists available, and that's why we work as one hand to treat the patient, and that's why our outcome, I can say, one of the best in the world.
Dr. Sayasneh, I'm very grateful for you to have joined us today, and I look forward to seeing you on other episodes.
Thank you for having me.
And future collaboration.
Thank you for having me.
Really, thanks.
Thank you.
So that was our take on the body, and also in particular the female health in relation of aging and also pregnancy and childbirth. In the next episode, we will look more carefully at performing as a finest design.